I think that there's a huge amount of work going on in the area. It's recognized as one of the big needs for Zika. I think it'll take some time. There are a lot of things going on, but development of FDA-approved diagnostic tests or even emergency use authorization tests can take some time. But there's a lot underway, and I'm hopeful that something will come along in a reasonable time frame, which might be several months or a year or longer. Yeah, it's an interesting question. These what we call emerging infectious diseases. We probably will continue to see this happening. It's been happening for decades, and I think it will continue to happen. It probably has always been happening. Interestingly, a lot of it seems to relate to crossovers from animals. For example, avian influenza, bird flu. These are viruses that circulate in wild waterfowl and ducks, and they cross into human populations and can really cause serious disease. Ebola probably comes from an animal reservoir and periodically into humans. MERS and SARS probably have animal reservoirs and move into humans. And now with Zika, this is a mosquito-borne illness, and normally these flaviviruses have a life cycle that is between non-human primates and mosquitoes with only occasional crossover into humans. For 50, 60 years, there were just sporadic human cases. But with increased crowding and urbanization, a different life cycle can develop. And there are some mosquitoes that can thrive in the urban environment, like the Aedes aegypti mosquito, which is the one that is responsible for the vast majority of Zika transmission. And in those urban environments, you get a different life cycle, and the mosquito can feed on humans and then infect more humans. And that's different than the typical cycle where it's mainly non-human primates with only occasional spillage into humans. So this vector in particular also transmits chikungunya, which is another one that we've heard about recent years, and dengue. It's a real problem, and I don't know that we have an easy solution. There are some innovative vector or mosquito-targeted technologies to try to reduce mosquito populations, but that's a real challenge. There's so much that we'd like to do, and so much that we want to learn about Zika virus. We have a lot of work to do. We're seeing a lot of patients. We're getting blood samples, urine, saliva, semen, vaginal swabs. We'll be studying the levels of virus, the persistence of virus. We'll be looking at T cells, B cells, antibodies. Somewhere in this immune response that we'll be defining for infected humans are the protective immune responses. And I hope that with the work we're doing in humans, we can provide useful information for developers of countermeasures, vaccines, treatments, and diagnostics.